Hi everyone. Today on the podcast, we're joined by Dr. Shahid Munshi, a seasoned clinician and leader in primary care with a strong background in training, mentoring, and academic guidance. He's currently leading a high impact care team in Manchester and brings a wealth of real world experience on how care delivery is evolving, specifically when it comes to improving the patient journey through smarter, more efficient healthcare systems. Dr. Munshi, if you want to add anything in your introduction.
Yeah. So basically, I've been educated and brought up in England. Um, as a family doctor, it's termed a general medical practitioner in England. But in other parts of the country, like in America, they call it family physician.
Mm-hmm.
That's just for the global audience, because they may not understand what a GP is unless you're
Yeah,
from the UK. So yeah, um, I'm looking forward to this podcast.
sure. Yeah, so with that, I would like to ask you the first question around the patient experience. So, what are the some of the biggest challenges in delivering smooth patient experience that you have faced in your overall career?
Yeah, I'll try and summarize it because there are quite a lot of points. The first point I would say is communication breakdown.
Mm-hmm.
There's a lot of miscommunication between clinicians and patients, and it can lead to confusion, dissatisfaction, and even medical errors. So patients struggle to understand medical jargon, um, while clinicians may not always have the time to explain things clearly. So that was the first challenge to communication breakdown, mainly because of time constraints.
Mm-hmm.
So, with increasing patient loads, admin tasks, clinicians are pressed for time. This can limit meaningful interactions and it makes the patient feel rushed or unheard. Again, this is because of fragmented care systems. What I mean by that is patients can frequently they can see multiple providers
Mm-hmm.
um, across different settings. So in my job, we are very holistic. We don't just look at the medical side, we look at the psychological and the social side. Now, mental health and social care have different IT systems to health medical doctors, which is a big challenge because then, because of confidentiality and everything, um, it's not integrated. So without the integrated system, it results in disjointed care. Luckily, in our team, which is one of the very few teams which is integrated,
Mm-hmm.
um, we have the social worker sat next to me and the mental health worker sat next to me in the same room. So we are saying, right, can you look on your system and tell me what you know about this patient? Um, so it might be to do with safeguarding or criminal history. I wouldn't know that, but the social
Mm-hmm.
worker would. So that's what I'm saying. Um, So, because of this, without integrated systems, it can result in disjointed care, repeated tests, and inconsistent information sharing. Number four is technology hurdles. So, while digital tools like electronic health records and telemedicine, they've got good potential, they can also be a source of frustration. Not everybody is IT literate.
Mm-hmm. Yeah.
Old people might not know what a smartphone is or how to use one, which limits everything then. So one of the things is you have to have one of the challenges at the moment is there's poorly designed interfaces. There's lack of interoperability. It slows down workflows and it distracts from the patient engagement because if you're stuck on the system, you don't know what to say to the patient because you can't see the blood results.
Mm-hmm.
So, then number six, where the area I live in, we have in North Manchester 80 languages spoken.
Mm-hmm.
So it's a melting pot of different cultures: Jewish, Muslim, Chinese, Ukrainian. Indian, anybody you can think of. There's 80 languages. Just imagine that.
Yeah.
So cultural barriers is a big one. Diverse patient populations, they require culturally sensitive care. So the NHS might say, why is this person, a female, not engaging with screening programs? Well, because it might be something simple like they need to see a female doctor. They
Mm.
don't want to see a male doctor. And so the patients can feel misunderstood and excluded from their own care decisions. They might even not be able to speak English. So
Yeah.
then you need an interpreter. So, and this is emotional and mental stress on both patients and clinicians because the clinicians are facing burnout. So then it affects their ability to provide compassionate care. So that's a long, long answer.
Definitely. And would you say that there are some of the common gaps that you see in the communication or care continuity, or that basically impacts the patient satisfaction?
Yeah. So, if you can't get through, for example, a typical scenario is I need to see a doctor today. I don't
Mm-hmm.
feel well. So, typical system is get on the phone and speak to the receptionist. You might be number 21 in the queue.
Mm. Yeah.
So most people are frustrated and they'll just put the phone down. Oh, forget
Mm.
it. And then they'll go to the wrong part of the health system. Oh,
Mm.
is this an emergency? Um, if it is, if you're that worried, you'll go to accident and emergency. But there, you might wait
Mm.
12 hours. You're waiting 12 hours. You haven't got time to spend all day just sat there.
Yeah.
So, that's a big gap. So I can see, like, if it was how AI could work there, chat boxes and predictive analytics, you could have a 24-hour um, chat box. It's not as good as face to face and a real person, but it will answer your question.
Mm.
Maybe, and it might anticipate your care needs or direct you to the right person. So, for example, oh, I've got a sore finger. I I cut it. I need a plaster. Where can I get one? It will say, go to the pharmacist. You don't have to wait 12 hours in
Yeah.
A&E to be told that.
Exactly.
um, so these things, they have to be empathy driven. The staff need to be trained in emotional intelligence and active listening. I don't know how you can get that from an AI, but that would have to be looked into.
Mm-hmm.
Um, then for patients, they might be at work, so they want flexible, accessible care. How are they going to get that? So you should be able to provide evening or weekend appointments or virtual consultations, which are user friendly, and they can make care convenient and inclusive. Um, there are also health equity initiatives. What I mean by that is, so at the moment, I do some voluntary work in Manchester on a
Mm-hmm.
weekend, occasionally on a weekend, where there are people who can't speak English, and they have problems. So the local community has a high incidence of heart attacks and diabetes, but they don't understand what is diabetes.
Mm.
So going there and just giving a face-to-face talk, interactive, making it interactive, and just say, right, what do you think you can do? Prevention's better than cure. Eat the right food, do this exercise, and you'll prevent all these complications. Um, but you need the patients to be involved and co-design to meet their needs.
Mm.
So if the ladies are there, they'll feel more comfortable if they're in a group of ladies rather than on their own in a
Mm.
male dominated room. They'd feel threatened. Whereas
Mm.
if there's a big group, um, then and you've got somebody who can speak the same language, you can translate. Um, so service design thinking, the care journey from signage to the waiting room to digital interfaces, anything to try and help. So yeah, that's the gaps.
And then, how do you think, like, where do you see the biggest opportunities for AI to reduce these gaps or the administrative burden that you have just highlighted?
Yeah, so that's exciting. I mean, basically, there are different things. It's still in evolution because there are pros and cons.
Hmm.
Uh, it's not just a one size fits all. If it was that easy, then it would have happened. But
Yeah.
so automated documentation is going to help, and it started. It's already started, where GPs are in the room with the patient, and they've got a voice technology where it's transcribing and summarizing the conversation in real time. So
Hmm.
it reduces the burden of having to type and manual data entry, and it improves the record accuracy as well
Hmm.
because it remembers what's being said. So in UK there are a few systems. One is called Lexicon. There's about 25,000 clinicians using it. Then you can use it for other reasons. I think it's more for that's more American. In England, they use it in private service, but not NHS that much. Is about the smart scheduling and billing because
Hmm.
you don't get billed for the NHS in most
Hmm.
cases, but it can help with appointments and it reduces admin.
Hmm.
So you're not number 21 in the queue. If you can
Okay.
just book it online or on your mobile, you can book your appointment on the mobile if you know how to use the app.
Yeah.
Then you can use it for claims, insurance claims, flagging errors, reducing turnaround times and human error. So that's a lot of paperwork that doctors have to do. They have to do reports for insurance companies. So if you've got all the information already there, it will save you half an hour. It would you can do it in 5 minutes instead of 30 minutes.
Hmm.
Then data management, update patient records to make sure the clinicians has got access to the most current information without spending hours on paperwork.
Hmm.
Because sometimes you have to do that. If the patient's complex, you have to read everything. Whereas if AI could summarize it for you, then it saves time. And there are clinical decision support systems, you know, so you get real-time evidence. So if, for example, you might have a patient who's got a rare condition, you don't really know much about it, and then you say, "Oh, can you come back next week? I need to look it up."
Yeah.
Whereas if you've got a system there, um, and then it will, reduce errors and it standardizes your care because you can access the latest guidelines.
Hmm.
Um, so it summarizes your consultations, this voice system. Uh, if the patient comes with multiple complaints, it can summarize that and make an action plan for you. Obviously, you have to then oversee it to make sure it's appropriate. So that's why, because it's not 100%.
Hmm.
Um, then there's health information exchange. So what I mean by that is, it enables secure sharing of the patient data across providers. So if I'm in hospital as a hospital doctor and I want to discharge a patient, it's like the traditional way was, right, I'm going to write a letter, dictate it. It will take 6 weeks for the letter to arrive to the GP. That's too long. The
Hmm.
patients come home, patients wondering, what do I do now? And the
Yeah.
doctor's going, I'll tell you when I get the letter. 6 weeks, that's too long. So whereas
Yeah.
if you can get electronic, data provided across the provider, there's a smooth transition on discharge from hospital.
Definitely.
Elect, Electronic health records, they centralize the patient information, they support medication reconciliation. What I mean by that is sometimes the medication that the patient went in with is advise stop that now, start this new one. But
Mm.
when the patient comes home, the patient's come home and he says, I want the new tablets. And the doctor's going, I don't know what your new tablets are. We'll wait for the letter, the traditional way, which was too long. Whereas this way, it's electronically already in your record.
Mm.
And then there's other things, remote monitoring wearables. So that's coming in now, where patients, the service I work in is called Hospital at Home, which
Mhm.
basically is a community service where the patient's gone home, say after heart failure, and now they are being monitored by our team every day. Um, and or say the diabetic, the hospital diabetic team can see on the mobile what the sugar levels are in real time. So that now you've probably heard of the sensors. You can just put a sensor on the arm, and
Mhm.
it stops you having to prick yourself every day.
Mm.
Um, it gives you, just put your mobile on it, and it gives you 24-hour readings
Mm.
immediately, and that makes it so much easier for the clinician to advise if they're on insulin what dose to be on.
Mm. Yeah, definitely.
Yeah.
So for the AI, I think while implementing the AI, both patients and clinicians are like at the center. Like it will benefit both of them. So I just wanted to understand your thought that can AI really improve experience for both clinicians and patients, or will it be like more for patient, less for clinicians?
um, Only time will tell, but it will definitely help both, and that can only be a
Mm-hmm.
good thing, because there will be more face time, face to
Mm-hmm.
face. Because at the moment, one of the barriers to getting to see a doctor face to face is the admin. The patient doesn't see that. The public doesn't see that. They just think, why is the doctor not seeing me? What they don't realize is, I had to personally myself about 10 years ago go in at weekends to the surgery to do the paperwork because I didn't have time to do it between Monday and Friday. I had to go on a
Mm-hmm.
Saturday or stay behind at night after 7 p.m. till 9 p.m. Who wants to do that? 2 hours doing paperwork when you've had a full day.
Yeah, definitely.
So if AI can help with that, um, then that's what can only be a good thing. For the patient, if you can get an appointment quicker, um, uh, uh, or sometimes you don't even need to be seen. All you need is some advice. So if the triage can be quicker, it might just be the doctor can say, okay, messaging. All you need to do is message. We have a 1 hour slot for the doctor, not to see patients, but just to do replies to messaging, or
Mm-hmm.
even use a video consultation, so
Mm.
they don't actually have to come in to the
Definitely.
surgery. So if the elderly, housebound, disabled, they might not be able to get to the doctors because they haven't got transport, or they have to catch two buses, and that's too difficult. So then, if they have a video consultation, and all they're worried about is they've got a rash here, so
Mm.
all they would have to do is submit a photo of the arm
Mm.
with a rash, and the doctor can give them the
Yeah,
answer straight away. So that's a plus plus for both.
definitely, definitely. And simultaneously, I think there are a lot of voices around whether AI will replace the doctors or not. So I just wanted to get your perspective on how do you see the future of AI in reshaping the decision making in coming future and evolving in a way that it strengthens the doctor-patient relationship rather than replacing the doctors.
Hmm. Um, I mean, they've started doing that, but there are the downside of it is, of AI at the moment is it's still what they're trying to address that in NHS England by having strict guidelines and data protection, GDPR, and all that. So they have to make sure that that is all in place, and that the actual information is correct, because sometimes the computer is wrong,
Yeah.
just as humans can be wrong.
Yeah.
So the doctor might have to actually just sense check it. So at the moment, there's the RCGP, which is the Royal College of General Practitioners. Then there's the big association bodies. They're looking at all these things to make sure that everything is as it should be. So they've tried a few things, like NHS AI Diagnostic Fund. That's looking at imaging and chest X-rays for lung cancer, and or in stroke networks, they you can get a brain scan much quicker than the traditional system, so it would
Mm.
half the time to diagnose a stroke.
Mm.
And time is of the essence in stroke and heart attacks, because you have to give treatment within the hour, it's called. And
Mm.
if that hour is gone, it's too late.
Mm.
Then the outcome is worse for the patient.
Yeah.
Um, yeah. So it will. One, it's giving more face time by automating tasks like documentation and scheduling. It frees up the clinicians to focus on the meaningful patient interactions.
Mm.
Uh, and it improves workforce sustainability because it's supporting better work-life balance.
Mm-hmm.
So for the clinician, and it's job satisfaction because you're actually seeing patients rather than doing paperwork, which can be boring if
Yeah.
all you're doing is paperwork for 3 hours.
Definitely.
um, so yeah, um, and it personalizes the treatment. So AI will tailor the care plan based on the patient's unique biology, his
Mm-hmm.
lifestyle, his preferences,
Mm.
um, which you might not get. Um, yeah, so the uses in the summary, I would say that smarter triage and booking, the clinical decision supports, which suggest possible diagnoses. Um, it can flag up during interactions, highlight abnormal test results. So it makes GPs more informed,
Mm-hmm.
and especially if they're dealing with complex patients,
Mm.
because it can be overwhelming if somebody says, "I've got 10 problems." um, and then you have to try and figure out, what are these 10 problems? Are they related to each other, or do they have to come back because I can't deal with 10 all at once? Whereas the
Yeah.
computer might say, actually, they're all linked. All 10 things are linked to one
Exactly.
diagnosis. So then you
And
can
also
manage the,
considering the fact that
yeah.
Mm. And also considering the fact that you mentioned that there are the place where you live in, there are people from 80 different languages, so they might have
Yeah,
different eating habits, different lifestyle
exactly.
habits, so it's very cumbersome to sort of diagnose each and everything perfectly. So I think definitely that point was correct, that AI can definitely help in diagnosing the complex cases and also the more diversity cases.
Mm. And so, like I was saying, it reduces the admin burden because it transcribes the consultation, it generates the referral letter. So
Mm.
I don't take half an hour writing the referral letter.
Mm.
It summarizes the patient note, and by automating it all, you get more face-to-face time with patients, which is
Definitely.
often that's in short supply. So, and predictive analytics, that's exciting, I think, because it's analyzing all the large data sets. So, for example, a patient well, I do a lot of home visits to patients, and you don't have access to all the equipment in the hospital. So you have to
Mm.
make a on the spot management plan
Mm.
using your clinical skills. So if you're using your clinical skills, For example, in a typical patient, I will check the temperature, check the oxygen saturation, do the blood pressure, um, and that will take me 5-10 minutes. Whereas um, now, then I have to write it down on a piece of paper or on the iPad. These are the readings, and you get a score. It's a scoring system. It's called the
Mm-hmm.
National Early Warning Score. So the
Mm-hmm.
National Early Warning Score is scored from 0 to 7 or higher. If
Mm-hmm.
somebody's scoring 7, they need to be in hospital. They're seriously ill. They might have sepsis. They might have sepsis, or something that needs immediate hospital treatment. So
Mm-hmm.
this scoring, if I do it traditionally, it will take me 15 minutes. If I do it on the computer, on the iPad, because this is a mobile device, so that's the good thing. I can take it on the home visit, this iPad, and put in the score, and it'll give the score.
Mm-hmm.
It works it out for me. So if there's any deterioration or a patient at risk of hospital admission, it alerts me and says, right, um, this is what you need to do. Or I can reassure the patient. If this patient scores 1 and the patient's actually quite anxious that
Mm-hmm.
they've got a brain tumor or they've got a brain hemorrhage, they think they've got something serious, and then we can actually say to them, look, you're scoring a 1. So 1 means that it's highly unlikely you're going to have anything more serious. So
Mm-hmm.
this is the so you can try paracetamol first for your headache, uh, and then you can say, right, if you know better, then you can um, review it again and contact us again.
Mm-hmm.
So it makes the consultation easier.
Definitely.
And then there's better resource allocation, and it's more proactive, because if the doctor's not experienced, he might say, oh, okay, on the safe side, go to a hospital because I don't know
Mm.
what's wrong with you. I don't
Yeah.
know what's wrong with you. If you don't have a scoring system, headache can be anything
Mm.
from lack of water, you've not had enough to drink, to life-threatening condition. So
Mm.
if you're not experienced, you'll just go, well, I'm sitting on the fence, go to hospital, ask the clever doctors.
Yeah.
Whereas if you're experienced and you've got AI helping you and you can back it up, for example, I had a case yesterday. I had a patient, 87-year-old lady,
Mm.
who she's frail. She had a fall, and she um, um, had had a scan 3 months ago, but now she had a high potassium and a high calcium in the blood.
Mm-hmm.
Now that can be any possibility. It can be um, dehydration, it could be cancer, or it could be kidney problem.
Mm.
Now, because I have mentioned cancer, I had to say, right, well, do you want this investigating at 87? You know,
Mm.
um, the worst scenario is you might have cancer. So what do you think? Do you want to go for scans? And she said, yeah, if it will tell me. Then I rang the hospital, and the consultant looked at all the results, which is basically like AI, because he had all the records on this patient, and said, oh, this patient's already had a total body scan in February. So it's unlikely another scan is going to make any difference. There's no sign of cancer. You don't need to go there. Signposted me. You need to speak to the kidney specialist. It's related to dehydration. Advise the patient to drink an extra cup of water.
Mm.
So look where we've got from going to hospital to having an extra cup of water. So then I rang the daughter back and said, look, good news is it's not cancer. What you need to do is drink more water, and we'll check your bloods again on Monday.
Mm.
And that's all
Okay.
because of having access to these records. That's
Definitely.
that's a real live example.
Definitely. It was great. Yeah, sure. Okay.
I think,
So yeah, please go ahead.
yeah, I think that's me. uh,
No, no, definitely. It was great speaking to you, and you shared quite a few examples and variations of how AI can uh, actually improve patient satisfaction and also experience, and specifically the last example that you have shared. So I think it was great speaking to you, doctor, and
all right,
look forward to connecting with you soon.
all right. Thank you, Jatin.